Tuberculosis cannot be killed with cooking. Cooking cannot deactivate the virus called Mycobacterium tuberculosis. Now that's a very big, that is something that many people think that we go boil and well. My dear, boiling no dey kill tuberculosis.
So for inside any meat now we want to boil, even though if the meat gets bad, that means boiling no go even do am at all.
No go remove am.
Hey.
That's what we're trying to preach, that we need more vets in the abattoir screening our meat. Okay. So meat inspection is very important. So that's what we're trying to do. Back in university, a dear friend and colleague died due to tuberculosis. As at then, it sounded strange up until I was posted to the Ondo State Veterinary Services, where I got to work not just as a veterinary doctor catering to the health needs of animals, but also as a veterinary officer inspecting meat for human consumption. The first time I got to the abattoir, I was greeted by aggressive butchers speaking in foreign tongues and ready to fight with just about anybody, including the veterinary officers inspecting and condemning their meat. But their machetes, foreign language and angry yelling did not scare me or push me to start the NTB campaign as much as the amount of tuberculin-infected carcasses condemned daily in the Ondo State semi-mechanized abattoir. My name is Dr. Chinorem Ukweni. I'm a member of the 2018 Batch C National Youth Service Corps, and this is all you need to know about tuberculosis. So, what is tuberculosis from your perspective?
I honestly do not know. I don't want to make a blunder. Okay. But obviously, the symptoms, I think it's coughing, obviously. So you just need to get it checked.
Okay, so when you hear the word tuberculosis, do you think it's something deadly, something that kills, or something that is just like every normal flu?
I do not, like I said, I do not know, but I do not think it kills.
Yeah.
I think any kind of sickness can lead to like fatality, but yeah. I think that tuberculosis is still within. I feel like science has caught up to it, so it can probably be managed.
It's a cough, a type of cough. When you cough, you bring out blood and what else?
Aerosols.
Okay, do you know how it can be contacted? Like how you can contact tuberculosis from another person or an infected person?
Somebody who is infected.
Yes, ma'am.
Yes, you can contact from somebody who is infected. Somebody who has HIV can have it.
It's actually zoonotic. That means you can get it from eating the offals of infected animals.
No. Okay. I didn't know that.
Tuberculosis is also zoonotic, so we're also advocating for better meat inspection and also people to check the meat they buy.
Is cough-related, heart-related infection, bacterial infection.
True, sir.
Resistant bacteria for that matter.
Yes, sir.
Yeah, it is infectious through the inhaling of infected air. Yeah, it can kill.
Yes, sir.
That's all I know.
Okay. I also want to ask you if you know that tuberculosis is the #1 curable killer disease in the world.
I'm not aware of that.
Okay. How do you think you can get tuberculosis?
I don't really know.
You don't know? Okay, no problem. So let me tell you that you can get tuberculosis from someone coughing, someone beside you having tuberculosis, and you can also get tuberculosis from infected animals like cattle eating animals that are infected. So I also want to tell you, do you know that treatment and detection, diagnosis and treatment for tuberculosis is free? Should be nothing is free in Nigeria. No, seriously, but diagnosis and treatment for tuberculosis is totally free. So we're just doing this campaign to let people know that this treatment is going on and it's free. You can just go to any healthcare facility. So if you see someone coughing for longer than 3 weeks, do direct the person to a healthcare facility to just get tested. All right.
No, I think from what I don't really know much, but from what I've read on the surface, tuberculosis is more like a communicable something. I think airborne. I think it's airborne. I'm not sure. Then I know the symptoms. This heavy coughing, like you feeling pains, probably in the chest region or something.
What is tuberculosis from your perspective?
Well, tuberculosis, I know it's a virus-infected disease that causes maybe consistent coughing and maybe until it gets to a stage when the person will be coughing blood.
Okay.
So maybe at that stage, it must have damaged maybe his lungs, so to say. That's what I know.
Sir, how do you
And
think?
the person will be getting lean and lean.
Okay. How do you think someone can get tuberculosis?
Oh, well, I don't know, but I know it's infectious.
Yes, sir.
It's infectious. So you can contact it from somebody who's carrying that infection. That's one thing. Then another thing, maybe, I know it's a virus disease.
Okay, sir. So it's actually a bacterial disease. You're closer. Yes,
It's
sir.
a bacteria, it's not virus.
Yes, sir. Yes, sir.
Because virus is more serious.
Yes. Yes, sir.
It's more serious than bacteria. So that the only way I can say that I'm sure of is contacting it from the patient, from a patient. That's the only way. But I know there could be other ways which maybe you doctors can easily identify.
Yes, sir. Sir, tuberculosis can also be gotten from animals like cattle.
Like cattle, yes.
Eating maybe cattle that has tuberculosis.
Of course,
Yes,
of
sir,
course.
You can get it.
Yes, I heard about that too.
Oh, okay.
And I've seen a cattle who has been infested with tuberculosis.
Oh, okay.
When the thing got slaughtered,
Yes.
the meat, turned black.
Oh, okay.
So, and so I was told that cattle has tuberculosis. So we had to call a veterinary doctor to come and pack it off.
Tuberculosis is a chronic bacterial disease which can be pulmonary or extrapulmonary, transmitted through inhalation, ingestion, or contact with the members of the Mycobacterium tuberculosis family from either humans or as a zoonotic disease.
I am Professor Simeon Cadmos of the Department of Veterinary Public Health and Preventive Medicine. I'm the coordinator of the Tuberculosis and Brucellosis Research Lab of the Department of Veterinary Public Health and Preventive Medicine. And I've been involved in tuberculosis research for over 20 years. And TB research is my passion. It's what I love to do. And that's why I'm talking to you on this subject. Well, tuberculosis, either in humans or animals, is a chronic, debilitating, wasting disease. And it has great impact on both human health and animal health. What is unique about TB is that it affects both humans and animals. And that's why sometimes we talk of zoonotic tuberculosis. But essentially, tuberculosis is caused by Mycobacterium tuberculosis. And it's been known that there are other species that also cause that will cause tuberculosis. And these include Mycobacterium africanum, Mycobacterium bovis. Bovis is of particular importance to us because it has a species that affects cattle, and that's why when we get to the abattoirs, the vets, when they are doing the meat inspection, they're looking out for TB infected lungs, liver, and the rest, because when man consumes this, they can also contract or contact tuberculosis from cattle. And again, humans can also get TB from cattle when they take unpasteurized milk from infected cattle. And of course, sometimes when we live closely with some of these infected animals, humans can also be infected. Classical example are those Fulani and some livestock workers who trade, who produce, who live all their lives living with cattle, so they can also get infected by inhalation, when they share aerosol with these infected animals.
Samuel Akure. I work with the State Ministry of Health, the Department of Public Health, where I oversee the tuberculosis, leprosy, and borreliosis control program as a program manager. Tuberculosis is a chronic infectious disease that is caused by microorganism, notably Mycobacterium tuberculosis complex. We said complex, we said that we have several of those organisms responsible for causing tuberculosis. So it's commonly affects the lungs, and in 70 to 80% of cases, and the remaining 20 to 30% of cases we see a form of tuberculosis that affects other parts of the body.
I'm Dr. Imu Adebayo, the Director of Veterinary Services, Ministry of Agriculture, Ondo State. Tuberculosis is an infectious, highly infectious bacterial disease caused by a bacterium known as Mycobacterium family. And the one that causes the disease in human is Mycobacterium tuberculosis, while the one that causes it in animal is Mycobacterium bovis. But what we discovered that a lot of emphasis has been placed on the elimination and the treatment of the Mycobacterium tuberculosis that is a constitutive agent in humans, with less importance on the bovis, which also can be transmitted from animal to human. So, in summary, the tuberculosis is a zoonotic disease. That is a disease that affects both animal and man. So the emphasis should also be on how well to prevent the disease in animal so that it will not get to human being.
When we talk about zoonotic tuberculosis, we need to think of an array of things. Like I said earlier, when we eat TB-infected meats, offals, it could be the lungs that people consume, it could be the liver, it could even be the spleen. But the practical way of preventing this, from the meat or meat products we eat is by making sure, essentially, that the vets do their jobs and make sure that those infected products don't get to the table, don't get to the food chain of humans. But when we want to take extra precautions, then probably want to cook these food products very well. And I guess that's why many of us Nigerians have been surviving despite consuming some of these infected products. Because by the time you cook, you fry, you boil and all the rest, the bug may die. I'm not saying totally, but in most reasonable cases they die. So that's one preventive measure. And of course, when we take unpasteurized milk, Nunu and the Fura they take, I know some pastoralists will even take the unpasteurized milk directly from the udder of the cow. But what is being advised is that when we pasteurize the milk, boil it very well, then the bug is also killed. Then it will not cause any major havoc to humans. Another preventive measure, of course, will be to make sure that we don't unnecessarily cohabit with infected animals. But how do we look at this for the Fulani herdsmen who day by day herd their cattle, live with their animals? And this is where government comes in when we do control, test and control. So those animals that are infected, will have to be culled so that we then raise healthy ones. And that's what has been done in the developed countries, where you have control measures being taken place in terms of massive screening of animals. And when I say massive, I mean massive screening. Conduct test and control measures. So those who are healthy are kept aside, those that are infected are culled. And with this, we can then produce healthy animals that will give us healthy milk to drink, and we can then eat healthy meat and meat products. Another preventive measure will also be that we know that lately zoonotic tuberculosis can be gotten by inhalation, because when somebody has been infected, probably let's say the pastoralist has been infected, and maybe through inhalation, and it also cohabit with other people, it can also spread the Mycobacterium bovis, which ordinarily would have been gotten through consumption of contaminated milk and milk products. So that's why we also talk about making sure that we don't live in congested places with those who are infected. And of course, good cross ventilation is another very good practical ways of reducing this. And when we want to go further, of course, when we reduce poverty, because when people are poor, they don't eat well, and when they don't eat well, they come down with the bug. And ordinarily, when you talk about TB, it's been said that many of us are infected with the bug. It's just that we have different threshold. So what then happens is such that when people are immunocompromised, poor nutrition, they're alcoholics, they're diabetic, that can also bring them down, and they come down with this disease.
Like I said earlier, that tuberculosis is caused by Mycobacterium tuberculosis complex. When we talk about zoonotic tuberculosis, we're talking about tuberculosis among animals that has been passed on to human beings. Zoonotic diseases are said to be diseases that human acquired, possibly from animals. So likewise for zoonotic tuberculosis, it has been acquired from animals, and notably among the Mycobacterium tuberculosis complex responsible for this is Mycobacterium bovine. You get to see this in ads of cattle. So cattle, I know in this part of the world we consume a lot of beef, which is meat from cow. So once we have infected cattle or bovine, we commonly call them bovine, call it bovine TB. Then once one is infected by the consumption of an infected beef, then such individual can come down with tuberculosis, and is transmitted from animal to man. Then we also have apart from cattle, we have other animals that can also cause that can transmit tuberculosis to human by virtue of consumption of the meat. It's been documented that in England, that some patients were infected by virtue of contact with cats, and I think recently it was also said that there was a record of some women who were infected by contact with chimpanzee. But trying to go back, they also discovered that the chimpanzee got infected from elephant as well. So
Nigeria is among the 14 high-burden countries for tuberculosis. HIV-associated TB, zoonotic TB, and multi-drug resistant tuberculosis. Nigeria is the 7th out of 30 countries in the world with high TB burden and is the 2nd in Africa. These statistics keep getting worse with the incidence of zoonosis, drug resistance, and HIV. It is estimated that 63,000 HIV patients get tuberculosis annually. 407,000 non-HIV patients also get tuberculosis annually, with 115,000 HIV negative and 39,000 HIV positive mortalities, summing up to 154,000 mortalities from tuberculosis annually, just in Nigeria.
What we can say about TB, bovine TB, is that at least I know that I can say that at least 10% of animals slaughtered, if not more, if thorough meat inspection is done, have bovine TB. And what are these things you see before slaughter? Could be an indicator when the animals are brought to the abattoir. Some of them they're emaciated, some of their lymph nodes are prominent, enlarged. And when you then go further to do the inspection, classically, TB affects the lungs. That's why we call it pulmonary TB. But in some instances, it affects other organs apart from the lungs. And when you see the lungs, of course, you have tubercles all over, nodules spread all over. Sometimes it be miliary, tiny, and stuff all over the lungs. And if it is advanced, you see them quite big. I call them tubercles. And when it is really, really bad, of course, the lymph nodes of the affected organs are involved. We talk about the lungs. Then it could spread through the heart, through the liver. And of course, we know liver is a delicacy for those who eat fried rice and what have you. So you see these tubercles on the liver. It also could be seen on the spleen. And the intestine too, you find them in the mesenteric lymph nodes. You know, they will bulge out. For those who have ability to do proper meat inspection, you'll be able to see that. The kidneys may also be affected. And bad enough, and that's why when it affects the lymph nodes of the mammary gland, then of course that's why the milk becomes infected and it becomes something unworthy for us to drink. So I guess these are some of the classical things you see, and that's why I always tell people, when you go buy some of these products at the market or at the abattoir, you need to look closely. When you buy the lungs, you try and palpate. If you see things that are, solid-like, most likely that may be TB infected lungs, so you don't buy. And of course, by the time you suspend the lungs you bought in water, if it is healthy lungs, it will float. If it is infected, it sinks in. So you know that you don't use your money to buy problem for yourself. And I guess these are some of the things you will see ordinarily, except if you want to join us in the meat inspection table.
What happens to animals that are TB positive and smoking and post-smoking?
They are supposed to be destroyed, condemned. They are supposed to be condemned because they are not fit for human consumption, and they are supposed to be incinerated and destroyed so that they don't get into the food chain.
My name is Adeluse Ayodele Victor, a medical doctor by profession, and presently I'm the director, Department of Public Health, Ondo State Ministry of Health. I'm responsible for looking after the health of the people of the state. We deal with both communicable and non-communicable diseases. When you talk about public health, you are looking at a whole population, not an individual. Like I said, my primary assignment is looking after the health of the people of the state. I'm aware Dr. Akingbesota will have spoken about the epidemiology, that is the disease burden, the number of people affected worldwide, in the states, in the country, in the states, even locally. We could talk about the number of people affected. It's not sufficient alone identifying the number of people
who are affected. The government has put in place a specific program to fast track the diagnosis and treatment of these people. And the federal government set up the National TB Leprosy Borreliosis Control Program to identify as many as possible, put as many as possible on treatment, and cure them. To prevent tuberculosis, you need to identify the source. We refer to it as index case. That is that individual who has tuberculosis who is not on treatment. Once you identify that person, you start treating that person. Within a few days, that person can no longer infect another person. So that's the best way to prevent the disease. Identify that individual who has tuberculosis who is not on treatment. And that's what the program is all about. Identify as many as possible, put them on treatment, and we know once you've identified at least 70% of the targets and you put them on treatment and cure them, within 4 to 5 years, the burden of the disease will significantly go down. Now, we have countries that have achieved this. I sincerely believe this can be done in this country. But for it to be done, we need to pass the right information to the people, and that people will need to do away with these nuances. Some people believe tuberculosis. When you tell some people this could be tuberculosis, the first thing they will do, I forbid it in Jesus' name. And once you have that kind of attitude, even when the signs and symptoms are apparent, what do? I've seen people that have been, when I was the TB program officer, I've seen people that instead of coming to the hospital, they've been to churches, they've been to herbalists, they've been to Muslim clerics. Look, educated people are that, looking for things that are not lost. But if our people will just do away with all these religious and traditional beliefs, anybody with cough, that's why we usually say anybody with cough, at least 2 weeks or more, should visit the nearest health facility where that individual will be assessed. If we think it could be tuberculosis, the test is done free of charge to that individual, and if it is confirmed to be tuberculosis, that individual is put on treatment. If it is not tuberculosis, then the individual is routed through the right means. that individual is asked to see medically qualified people who will solve the problem for the individual. So what the government, to cut a long story short, what the government has done is putting a special program in place to identify as many as possible and put them on treatment. And the program the government has mobilized resources from within and outside for the program to do what it has to do. That's the reason why the diagnosis is free and the treatment is free.
The prevalence for tuberculosis, but we don't have a state-specific prevalence rates. What we use is the national prevalence rates. The national prevalence of TB prevalence survey carried out in 2012 came out to say that in the statistics said for every 100,000 people, we see the prevalence to be 353, meaning that 323 per 100,000 population. That is, if you have 100,000 women, you expect like 323 of them to have tuberculosis. And this is what the country is using, this is what the state is also using, and this is what we also use for the local governments.
Dr. Francis Adegoke Akombiemu. I'm the Executive Secretary of the Ondo State Primary Healthcare Development Agency. The prevalence of tuberculosis in Nigeria, statistics are not uniform. I won't be able to commit myself into that. But worldwide, the last report showed that about 9.6 persons in the world are infected with tuberculosis, of which about 5.4 is men, while about 3.2 is women, and about 1 million or so is by children.
Notwithstanding, the number of private hospitals, government medical centers, and over 6,000 directly observed treatment centers scattered in every local government of the 36 states of Nigeria offering free tuberculosis diagnosis and resistant, there is still a very low data on tuberculosis cases in both adults and children reported to the health care facilities.
I think Nigeria is part of those who signed on to the United Nations Declaration, which was done last year. And that was, they call it the high-level meeting at the United Nations. And I know the wife of the president is the Nigerian ambassador towards making sure we control and eradicate this disease. But that aside, practically, I think we've had an expansion of the directly observed treatment centers where they treat TB patients, and there has been increase in diagnosis through the introduction of the gene experts. The gene experts has come up as a new technology that within 2 hours you could diagnose those who have TB. But the problem we have is that we don't have functional dot centers, and we don't have enough diagnostic capacity to cater for those who have this problem. Because as I speak, I think they say we have roughly 300 and something gene expert machines, and that means these gene expert machines has not covered the whole nation, where we have 774 local governments. And in each local government, if we are really at speed with what we're supposed to be doing, I guess we should have over 3,000 gene expert machines, so that as many people as possible will be screened, since we are making gene expert machine the technology of choice instead of the conventional microscopy. Government has a lot to do, and unfortunately government is also dependent on foreign support. The question there is, if the foreign support drains out as it is, what happens? We have to be able to take care of our people. We have to be able to take care of those who have TB. TB, unlike HIV, can be contracted, just by you talking to somebody who has a problem. HIV, you go extra miles. So government really needs to do a lot of advocacy, take care of the healthcare workers who are into this care, because I've had instances where I work with some of these healthcare workers and we don't get that maximum support from them, because they said they're also not well incentivized. So we need to encourage them. Government needs to improve on the dot centers, include on the logistics. I'm not saying they are not trying, but a lot more needs to be done.
Well, my name is Dr. Stephen Oluwasujolo Kwarija. I'm one of the veterinary doctors in veterinary Ondo State, Ministry of Agriculture, Veterinary Hospital, Akure. Control, or maybe prevention. When we, ideally, if you see if there is any sign of TB in any animal, the ideal thing is to remove and condemn and bury. During meat inspection, any lesion of tuberculosis in any animal, if it is a localized lesion, localized in the sense that it's not all over the body of the animal, we cut off that portion and destroy. But if the lesion is generalized, that is, can be noticed in all the parts of the animal is removed and destroyed. It will not be allowed to be passed for public consumption. And live animal is almost the same process. When you notice an animal that is showing sign of TB, it's supposed to be isolated, monitored, and once it is confirmed, either through tuberculin test, it's supposed to be eliminated so that it doesn't continue to spread the TB cases to other animals.
For TB control, we just like I said earlier that when you look at the prevalence, to some of us we say it's a rare disease because the global TB report of 2018 put the incidence rate for tuberculosis in the country at 219 per 100,000 population. That is, for 100,000 population, you get to see 219 human beings coming down with tuberculosis, newly diagnosed tuberculosis. So because of that, we say, okay, that means for me to have like 3 patients, I need to screen like, if you put it that way, I need to screen like 1,000 people. But because we know, yes, tuberculosis is highly infectious, it's possible that even when you have one in the neighborhood, you should be rest assured that you have so many TB patients around, because it's been said that one untreated TB patient can infect 10 to 15 people annually. So for the progress regarding control, there is what we call targets 70 and 85, meaning that for you to say you are controlling tuberculosis, you must have been able to detect 70% of the estimated TB cases. And even when you identify the 70% of your TB cases, you should be able to cure 85% of them. So that's when you can say, yes, we're controlling TB. Nigeria as a country, the best we've had was in 2017. We were able to identify about 25% of our TB targets, meaning that we still have like 75% of people unreached.
If I could recollect the figure that was submitted the last time, I don't have it here now. We are not making good progress. We are making progress at the same time we are not making progress. We have let me use the word markers, because any business you are doing and there are no markers to mark the progress, then you won't know whether you are succeeding or not. There are 2 key indicators we use in monitoring the progress of tuberculosis. The first indicator is the number of people that were identified, and the second marker for our people listening at home, the second marker, the key one, is the people you are putting on treatment. How well are they doing? So the first one, that's the case detection rate. For example, it's estimated, if it is estimated that you have 10,000 cases, how many of these 10,000 cases are you finding? You need to know what progress you are making. Unfortunately, the last time I spoke with the program officer, I think we're on about 12%, between 12 to 15% of the cases. We're only finding less than 20% of the cases, and this is quite disheartening, because the reason why I say this is disheartening, every patient you missed that is sputum smear positive, that is that individual that once you take the sputum, collect the sputum, look at it under the microscope, the result comes out positive. That individual, if is not on treatment, has the capacity of giving rise to 10 to 15 new cases with each passing year. So you can imagine the number of people that we are missing. I think we are only finding, out of every 100 estimated, we are only finding less than 20. You can imagine at the end of the year, the multiplier effect. So that's why I said we are not doing so well, because we are finding less than the expected target. For every 100 TB cases estimated, we are supposed to find nothing less than 70 of them, 70% of the estimated cases. And for the other side, where I said we are doing very well, it's not sufficient for you to start someone on treatment and that individual is not cured. In tuberculosis, we are of the opinion it's better you don't start that individual on treatment than let the individual start on treatment and not complete the treatment. In Ondo State, we are doing very, very well. We've attained, I think the cure rate, not that I think, I know the cure rate is over the expected target. We have a cure rate of almost 85%. The old indicator, the gold standard is, when I mean cure, the individual may still have corp because the lungs may have been destroyed, presenting late. That is, we are not able to find evidence of a disease-causing organism in the sputum being produced by the individual. When I was program officer, you take sample, look at it under the microscope, you find the bacilli staining red. That individual is classified as positive. At the end of treatment, if that individual if you can't find that disease-causing organism, Mycobacterium tuberculosis in the sputum, that individual is declared cured. The target says 85% of them, 85% of the people we are putting on treatment should be declared cured, and we are achieving this. And if you can't find the I don't want to go into the technicalities because there is this treatment success rate of 90%. That is, the people you are putting on treatment, if they are completing their medication, they're taking the right dosage for the right duration of time, at least 90% of the people who are starting on treatment should complete treatment. We are doing very, very well in that side, but we are not finding the cases. The cases are there. They are there. It's been confirmed that the cases are there. We know they are there.
The government is actually aware of the dangers and the public health burden of tuberculosis. During the last TB day, the state government committed resources into public enlightenment. If you will recall, staff of this agency went out for public campaign enlightenment of the public, and case searching in respect of TB has to increase in this agency. And one way of getting good results in case searching is having a standard laboratory, and that is why recently Mr. Governor have approved the recruitment of laboratory technicians and scientists, including other health workers, who will be involved in case searching and laboratory investigation. In other words, government commitment on TB eradication is higher than ever. It's a record that this is the first bold attempt by any government, not only in Ondo State, across the country, to really agree to injecting new laboratory workers into the human healthcare system, and their responsibility is to help in the diagnosis of all kinds of diseases, TB as one of the special focus.
Owing to the obvious information gap on tuberculosis in Nigeria as a developing country with a high level of illiteracy, hence the birth of this campaign to educate the at-risk individuals and link them up to healthcare facilities already providing free medical treatment for tuberculosis through awareness campaigns held at the market and the semi-mechanized abattoir targeting the abattoir workers, cattle traders, market women, and the general population.
I'm sure you already know this yourself. When you look at TB, when you look at HIV, when the HIV problem was at its peak, or it was brewing, a lot of money was pumped into it, a lot of money. And of course, where you have money, you could also do a lot of advocacy. Unlike TB, not many people know about the problem. And unfortunately, TB can spread like wildfire more than HIV, and that's why it's not surprising that TB has overtaken HIV as the #1 killer disease in the world. And what we're having is that people are not well informed. The media houses need to do more. Both social media need to do more. Our advocacy needs to go to the rural areas to please, in the name of God, have more presence at the abattoirs, because when you carry out comprehensive meat inspection, you are sure you'll be able to identify some of these infected animals, and you'll be able to take them off from the food chain. And with that, people are taken care of. I mean, people will not end up eating infected meat or meat offals. And unfortunately, again, we know that because of poverty and ignorance, people, just like in Oyo State, they call it fukwelegusi, and it's supposed to be a delicacy, and it's because of ignorance. So I guess education, with the vets doing their job, government doing some bits, and all of us as a people, we are doing what we're supposed to do in terms of awareness, taking it to the primary school, to all the facets of our lives. I'm sure we'll be able to get things going, and we'll take care of this problem.
Government, it has been doing a lot. The issue of advocacy, and I believe majority of Nigerians, we do not know much about TB. The government set up a TB office that is monitoring TB cases in the states, and then educating the public on the hazard of TB and how to reduce TB cases in Ondo State.
The CAP survey, that is the Knowledge, Attitude and Practice survey, carried out in 2012 as well. I believe one was done in 2017. We're still expecting to the national program and the partners to roll out this information so that we can see. But as at 2012, from that report, the CAP survey report, it was said that about 30% of Nigerians don't have, they don't really have the basic information on tuberculosis. And if you want to control a disease, then the general population should know about that disease. Just like when the battle against HIV started in the country, it used to be a thing that but now people are aware when they want to go for that. But for TB, you see that yes, that's already that a lot of people don't really have that information. I think I've been to local government before that. The local council government chairman for that particular local government was surprised when I said, okay, we have TB patients there. We see have TB, an educated fellow, to say that. So because of that, yes, we're not really, people don't really have the basic information on tuberculosis, and that is what it's an area that we are looking into. And we commonly say that when you switch on your television or your radio, you get to hear messages on HIV, on malaria, which these diseases are not airborne, but the one that is airborne, which is tuberculosis, you don't get to hear anything.
Although a deadly plague, tuberculosis is curable. A friend of mine once had tuberculosis at age 23, which developed into the multiple drug resistance form. But after a period of faithful and deliberate adherence to medication, Today, she is tuberculosis free. You cannot boast of a clean health bill if you don't know your status. Prevention is better than cure. Locate a health facility today and get tested. If positive, know that tuberculosis treatment is free. Remember to encourage everyone around you to go for tuberculosis tests, especially those coughing for longer than 3 weeks, coughing out blood or catarrh, those experiencing rapid weight loss, those experiencing other general signs like fever, body pain, and fatigue. Discourage the stigma against tuberculosis patients, but encourage them to not spit anyhow, cover their mouth while coughing, wear a nose mask, adhere to their tuberculosis medication, and remember, let's join our hands together and fight against the menace called tuberculosis. Remember, the safest way to stay free from tuberculosis is to stay HIV free.